everyone, this is Pallavi Priya and today we are going to talk about coding of injuries in ICD-10 CM. Now, coding of injuries generally comes under chapter 19 of ICD, that is about coding part. But in this case, we have several topics. The first would be, what is an injury? Now, injury is any potential damage to your body part. It can be accidental, it can be any hits, any falls, likewise. Based on that, you have got two types of injuries. One is superficial injuries and the other one is severe injuries. So, superficial injuries are generally very light type injuries like abrasions, scratches, which are not taken very seriously and they are not coded in ICD-10 CM. But when we talk about severe injuries, they are the most complex ones. So, whenever severe injuries are along with superficial injuries, we only code the severe injuries as principal diagnosis. The next topic would be coding of burns and corrosions. Now, burns, as we know, that's also a damage to the human skin or a human body due to excessive heat. Corrosions, on the other hand, they are burns due to chemicals. Both burns and corrosions, they are coded accordingly in ICD-10 CM with the help of T31 and T32, which are based on rule of 9. Now, when we have multiple burns, the sequencing also changes. So, in cases of multiple burns, the most severe burn is coded first. The same goes for multiple fractures also. When we are coding for traumatic fractures, so the most complex or the most severe fracture will be coded first. Now, how do we distinguish that? Suppose a patient has got multiple fractures in his body, say a cranial fracture or a radial fracture of the right hand, or say another one would be of a foot. So, out of the three, which is the most severe one? Okay, the most severe one will be the cranial fracture, so that would be coded first, followed by the secondary and the tertiary codes. This is about coding of traumatic fractures. When we come to coding of poisons, underdosings, toxic effects, we have certain codes related to that also. So, when we talk about the difference of underdosing and toxic effects, underdosing means what? Underdosing refers to any kind of medications, okay, which are not taken in proper dosage, okay, limited dosage, not the actual part. So, that is underdosing effect. Toxic effect means excess effect, which is creating toxins in your body. Okay. So, that is about the toxic effect and the underdosing part. When we come to adult child abuse, neglect and maltreatment, then we have confirmed and suspected conditions in that also, and the codes will be variable accordingly. The last would be the complications of care. The complications of care may include your pain due to medical devices, then transplant complications, in that you have kidney transplant complications. You must have studied kidney transplant complications in terms of malignancies also, that is chapter 2, neoplasms of ICD-10 CM. Okay, and that would be the overall summary of coding of injuries in ICD-10 CM. Thank you. That would be all.